Hello and welcome to this week's episode of For the Love of Chiropractic. I'm your host, Dr. Robert Freeman, and to our long-term listeners, I want to say welcome back and thanks for tuning in again this week. If you're a newer listener, I'm going to encourage you to listen, enjoy, tell others about the show, and most importantly, make sure you pause right now and hit subscribe. And the reason you want to hit that subscribe button is so that you never miss an episode, because each one builds to help you go where you want to grow. On today's episode, we're going to be talking about one of the 5 basic interactions that we as chiropractors have with each of our patients on a daily basis. We don't do all 5 on each patient every day. We do at least one of the 5 with each of our patients every day. So today we're going to be talking about one of those 5. We're going to be talking about re-examinations and re-reported findings and patient progress. So let's get started. Welcome to another episode of For the Love of Chiropractic. I'm your host, Dr. Robert Freeman. I've been in practice for over 30 years, and I continue to work in a $1 million practice that I built, ran, and sold. I've taught, lectured, and coached our profession and helped so many chiropractors build the practice and the life of their dreams. And now, I want to help you do the same. So here's today's show. As I said in the introduction, today we're going to be talking about one of the 5 basic interactions that you have with patients every single day. On previous episodes, we've talked about some of the other ones. So what are the 5? Your day 1, your day 2, your regular patient visit, your re-examination and re-reported findings, and a new patient class or healthcare workshop of some kind. On today's show, we're going to be talking about that re-examination, the good, the bad, and the ugly, when to do them, why to do them, why we hate doing them sometimes, why we need to do them on a regular basis, and most importantly, how, when, and where to do it and to communicate the information to the patient about their progress to date. So let's start from the beginning. Why are we doing them? We're doing them because we know the patient is getting better. The patient typically knows they're getting better, unless they're not. We know they're not getting better, and they know they're not getting better. We've got to find out where they are. But most of the time, you know they're getting better, they know they're getting better, and often there's a third party of some kind, whether it's an insurance company, an attorney, a spouse, that wants proof, wants progress, objective measurements of the person's results to care so far. And over my years in practice, I know doctors who love doing a re-examination. They do a re-exam every 30 or 31 days on every patient like clockwork, whether the person has been in for daily care, 3 times a week care, twice a week care, once a week, or once a month care. They're doing that re-evaluation to get good, hard, solid measurements exactly where the person is today. And if that is clinically necessary and relevant, then I think that's terrific and perfect and wonderful and absolutely appropriate. On the other hand, if there's some other reason that it's being done, a financial reason, then obviously that is not the right reason to be doing those re-examinations. And at the opposite end of the spectrum, I know other doctors who hate doing reevaluations. They never like to do them. They put them off as long as possible. I have actually seen notes from doctors when I do chart review in different situations where the person comes in for an initial examination and consultation, and they go through a course of treatment of months or even a year or 2, and there's never been a written progress exam. And again, I think it needs to be done on a regular basis for the right reason at the right time to get objective measurements so you know where you're going. In the state where I practice, the state licensing board takes a very broad view of it should be done at an appropriate time, and appropriate is left to the board members. The generally accepted rule is about every 12 visits, and that makes sense. If a person's coming in on a 3-time-a-week schedule, that's about once a month. If the person's coming in once a month, That's a full re-exam once a year. And again, you can see the logic that you want to make sure you're not missing anything and you're getting good objective information. So having said that, let's take some time and talk about how we do this in the most efficient manner. So about a week before the re-exam comes up, you want to tell the person, the patient, we're going to be doing a reevaluation with you to measure your progress so we can see exactly how you're doing now. And they'll either say good, or I think I'm fine, I don't need it, or I'm not doing fine, and I think I need it. Whatever it may be, it doesn't matter. It needs to be done. You've made that clinical decision at this time. So they want to make sure they stay on their care plan up to the re-exam a week from now. And you may give some other recommendations about things they should or should not do as they're approaching the re-examination regarding outside exercises or therapeutic exercises in your office, different medications. Depends on the specific patient. When we do re-examinations, when I do a re-examination with a patient, I want them to be as natural as possible. And what I mean by that is not all super hyper-caffeinated and not all stretched out having just come from the gym or not, having done nothing all day. What do they really look like as their natural selves going through their natural day? And when they come into the office, they fill out a subjective form similar to the one that they filled out on their very first day. If you'd like a copy of that, reach out to me via the website and I'll make sure you get a copy of it. The website for the podcast, fortheloveofchiropractic.com. And under Contact Us, you'll see a space that you can send me the question with your email address, and I'll make sure you get that. So when they fill that out, you've reviewed it, and it says right on there whether they think they're getting better, worse, or same. Do they have any new complaints? And are there specific activities of daily living that they still can't do, or ones that they can do that they weren't doing before? You have the old one, you have the new one. It's very easy to compare. So when you walk into that reevaluation, you already know whether they think they're doing better or worse, which is terrific. And you know from treating the person whether you think they're getting better or worse and what you're specifically looking for. And then go through the exam process, the range of motion, the orthopedic tests, the reflexes, the muscle test, the things you typically do. And as you start to acquire the information, looking at the range of motion, if that's what you happen to do first, that's what I do and recommend. So that goes through cervical flexion and extension and lateral bending and rotation. You're looking to see where are they now compared to where they were a month or two ago, whenever the last evaluation was. And as soon as you see that there's been improvement, I think you should tell them, wow, that's a lot better than it was. It's not all better yet, but it's doing so much better. And now you're in conversation with the person as you're giving the information. Yeah, doc, I thought it was doing better, or it's still stiff on that left side. Yes, I know that, and I agree with you. And we're still working on that. And you're making notes along the way. You know what? It is stiff on the left side, so we're going to be adding this specific exercise or doing this specific soft tissue, if that's what you feel they need, or this specific other modality. Maybe it's ultrasound, maybe it's laser treatment, lots of things it could be, to help them with that specific problem. And you go through the entire examination that way. So as you finish going through the reevaluation, having done all of the parts in a clean, concise, specific order, you're then ready to give them the re-report of, just as we finished saying, you're doing terrific with care, or you're not doing terrific with care. So we're going to continue doing exactly what we've been doing for another 4 weeks, for another 3 weeks, or you've been doing great, so we're going to step your care up to only twice a week now. Not stepping down. I think down is worse and up is better. So we're stepping up our care because you're doing better. It's subtle, but it's important. As we go along and we're talking to the person and giving them this information, what we're going to be adding, what we're going to be changing, the fact that we've reached this milestone, we want to congratulate them on the progress that they've made. how they're doing exactly how you've expected, or better than you expected, or you know what, I'm a little disappointed, it's not as good as I thought, but still within the normal range. You want them to know you're loving them and leading them, and they're doing just fine, because that's how it's supposed to be. You want to have performed this examination in the exam room, not just in the adjusting room. And the reason is you need to have all your tools there, and the stage needs to be set, as we said on a previous podcast. That's your theater. That's where you do examinations. It's different than a regular adjustment, so you want them to know it's different than a regular adjustment. We're in a different room. We're doing different things. They're sitting up. They're not laying down. It's like that first day when we did all the other tests. Yes, because we're doing tests. We're doing an examination. So that's why you want it to be in the exam room. I know it takes an extra minute or two to do it that way. It's better for the patient. And it's better for you because you have all your tools there, and it creates a different mindset for both you and the patient. You're in the proper state to do an examination. You're looking with a fresh and different set of eyes. And once you've gone through and done the exam and given them this re-report of what you're going to be doing, then you can tell them to go ahead and get dressed if you had them gown, or they can go ahead and get their things together and stop at the front desk, and the front desk will then tell them what room to go to or what area to go to or what to do next. Maybe it's therapeutic exercises. We're going to start you with some new exercises, and my assistant will show you those, or they'll escort you to the adjusting room and we'll do what else we need to do. And it's easy and flawless. We pre-framed that re-examination for the patient before we did it. We started a week ago. In about a week, we're going to do your reevaluation. I don't expect it to change your treatment schedule unless you do. Then you say, if things look as good as I expect them to look, then we'll change your treatment schedule based on what we see. You and the patient go into the reexamination, but the patient especially with an expectation of what's going to happen. Because if you do not do that, automatically the person assumes we're doing an examination, so it's time for me to start coming in less. And maybe it is. But why not tell them ahead of time so they know what to really be prepared for, so that way their expectations are met, and in no way, shape, or form are they disappointed. That builds you up, that builds your practice up, and again makes you the expert and the go-to place for any of the issues that you treat with your patients. When you come out of the examination and swing by the front desk to tell them where you're going next, I think it's important as you hand the chart off, if you still have any type of paper chart, that you say to the front desk person, all right, we finished the re-exam with Mrs. Smith, and she's doing great. She's getting better exactly the way she's supposed to be. She's just terrific. It's such a pleasure to be working with her. And you want to say those sorts of things so the front desk gets the kudos and knows about the good work that's going on in the office. And by the way, you did not use a first and last name together, so it's okay if there are other patients in the reception area that heard you say that, because they like hearing that you're helping other people get better, and they're glad to know that you're such a good doctor and people are doing really well. Well, what happens if that's not the case? We finished the exam with the lady in the back, or with Mrs. McGillicuddy, and with what we saw going on, we need to step her care to the point that we need to see her in room 1 so that we can use that special procedure that we do in that room to help her get better faster. Again, the front desk knows what you're talking about, and you can fill things in like flexion distraction or SOT blocking or whatever you may be doing with a more acute patient. But they know that. And again, anyone who happens to be listening is going, doctor's really good and really caring, making sure that people really get what they want. And if you don't think that people are actually listening to all the things that you do and watching all the things that you do and the things that you say, then you're very much underestimating how much people respect and admire their doctor that they've chosen to go to and are paying their money to see. I believe, and I have seen, and I've learned, they're watching everything that you do all the time. And that goes back to some of the other things that we've talked about on some of the other podcasts about the stage being set, the office looking a certain way, the patient experience that you provide. So many of the things that we've talked about on the 24 plus episodes that have gotten us to this point, making sure everything is the way that it should be for the optimum patient experience. Each time you lay your head, your heart, and your hands on and with people so that they're getting the information and getting better on schedule the way they should be. So now you're in the room, ready to adjust the person as you had been up to this point. And about a quarter of the time, maybe a little bit less, a little bit more, the person will say, "So what'd you find in the re-exam, doc?" Even though you just went over it with them in the exam room, and that's not a problem. They obviously didn't catch it. So pause and tell them again exactly how good they're doing. And if they look at you with that inquisitive look, it's because they're more of an analytical personality than you thought they were. So what they really want to hear is, so your range of motion was restricted by 50% in the neck area. Now it's only reduced by 10%. And the test where I was pressing down on your neck, cervical compression test, or when I was pulling up on your neck, cervical distraction test, that was positive before, and now that it's negative. And sometimes they'll say, well, how could you tell? And you can explain, I'm looking for obviously a pain response, but even more important than a pain response is the elasticity of the joints, the muscle tension, and the range of motion as we go through these different tests. And for the analytical person, they take all of that and that makes sense. That's what they wanted to hear. Obviously, if the person is not analytical, you don't want to give them the specifics because you're just going to bore them to death. If the person is more of a driver personality, you tell them they're doing great, they're doing exactly the way you expect them to be doing, and go ahead and lay down so you can get them adjusted and keep getting them better because they want to get in, get out, know you're in charge, and got it, and keep going. If they tend to be more of an expressive personality and everything is, oh my God, and over the top, you want to make sure that you give them the same thing back. Oh my God, I'm so pleased with your care. It's so much better than it was. You're doing great. Because that's how they listen, that's how they express themselves, and that's how they hear the world. So that's what they're wanting back from you. And if they're just an easygoing, amiable personality, they want to know everything's great, fine, and terrific. You've got them, you're moving forward. We're going to keep going, keep getting better, and everything's just fine, and you're going to keep doing just great. We're going to add those specific exercises, and you're going to keep getting better right on schedule. And obviously you can tell them when you expect their next reexamination to be as well. 4 weeks from now, 2 months from now, 6 months from now, whatever it may be. Continue to work with the patient and they're going to keep doing just great. All right, and that's our show for today. If you have a question about today's show or your own practice, feel free to reach out at fortheloveofchiropractic.com. Before making changes to your practice, be sure to seek legal advice regarding those changes and regulations in your state. For the Love of Chiropractic is an RGF production, all rights reserved. And thanks for listening. Original music provided by Hunter Rich Music.